Hi guys, how are you? It's Dr. Pam, academic coaching for world changers, and thanks for stopping by today. We're going to just do a couple of today just a question. Dr. Pam does not believe that taking questions is ever studying. Reading, watching my video over and over and over is really the best way to study. We do realize that many people watch our videos all day long and pass just by watching our videos. And that's what we want. We want to be in your head. We recognize that you don't have a lot of time. However, this needs to be the priority, the most important thing in your life for 90 days. What we find is if you find yourself talking back to the screen and you're not sure why it's the answer, you might want to join us for a live session. So let's get started today. I'm going to say to you, always invest in yourself. You are worth it. If you haven't used those CAN programs and you're finding out it's not working for you, invest in some private tutoring. We do small group, of course, and individual tutoring. So today we're just going to look at some questions. So I really make sure that we understand the types of questions that we have. We have both application questions and recall. An application question, you're always going to make sure that you assess first. We get paid to be nosy, remember? So we ask questions always, always, always. So I'm always going to start with assessing. If a question says, what do I do? Or what do I do first? Or what should I do next? I'm always thinking to have all the information. We all know in the practice field every single day that we thought we've got all the information, and suddenly a client tells us something we didn't know. Exactly. So when we have application questions where we have to apply the information, that's where people really struggle. So these are the rules of how we apply. We're going to assess, assess, assess. Remember, we're always getting paid to be nosy. If the question is full of feelings, we're going to make sure that we address the feelings. If the question says that the client is crying, we're not going to ignore that. We're human. We never do that. And remember, safety comes first. The client's safety, also my safety. It's important. The Code of Ethics says I have a right to work in a safe environment. Remember, we plan with the client, never ever for the client. We never tell a client what to do. As we're coming in and we're doing our assessment and we're doing our plan, remember that treatment then drives our treatment plan. So our goals that are measurable goals are driven by the treatment plan. They're also driven by my theoretical orientation. So for example, if I'm an existentialist, we might not have measurable treatment goals. And remember, termination starts at the beginning. The minute we see the client, the goal is to get ourselves out of that client's life. The other one are, of course, are going to be the recall questions. Those are questions where it just requires, and people say higher level thinking. I'm not going to say critical skills. I really don't want you to bring in critical skills. I want you to think about higher level thinking. Those are the ones that are very vague, and you're really not sure how to answer those questions sometimes because it doesn't even mention the theorist. So Bloom's taxonomy is what we're looking for. Bloom's taxonomy tells us how we think. In the beginning, what we used to do really is we started off with some simple, very, very simple, just remember. So all those questions now, and when it comes to our theoretical orientations or how we treat, are not about remembering. We do get to memorize when it comes to a research and a stats question. I know, right? So, but most of the questions are going to be understand and then apply them. And then sometimes we have to analyze the question to understand where it comes from. Those one-line questions to me are so hard. You get one line, and if I don't know the theorist or who they're talking about, sometimes I'm just out of luck. So we're really going to make sure that we understand the content as well as how to apply. That's how we pass any standardized test. So I'm always going to remind you, it's a reading test. It's a reading test. It's a reading test. There are a couple of other tutors out there that will tell you that they're things that are distractors. I disagree with that. I think everything in the question is put there for a reason. They're giving you hints and clues. That's how we all pass a standardized test because everybody reads the exact same words. If I bring in what happens in my agency or in my experience, that doesn't matter unless it's in the question. I've always said to the people that I tutor, my wonderful clients, is that if it has your name, first name, last name, and I'm going to go ahead and put it out there, if you see your social security number in the question, that's the only time we care what you think. Other than that, it's a standardized test. We are looking at what does that theorist say? What does that research say? What does the textbook say? Not trying to make you a better therapist. You're already great at what you do. I'm going to make you a really, really good test taker. I'm going to remind you it's a reading test. Okay, so here we go. Here's our question for today. How would a study aimed at examining college students' attitudes toward tuition increases demonstrate external validity? What? Oh my God, Dr. Pam, no. Okay, we're not going to freak out. We're going to really spend time in the question trying to understand what they're asking me. If I could say, don't look at any of the answers, that's really the best thing to do. Understand the question first. What happens most of the time where my clients are down in the 4 answers and trying to figure out based on the 4 answers, but they don't even really get the question. So how would a study, I'm doing some research, obviously, it's aimed at the attitude of college students. I'm measuring attitude, okay, towards students' tuition increase demonstrate external validity. One of the things I can tell you in this question is if it's measuring attitude, that's a construct. That's a social construct. Attitude is something we have to come up with. We have to define what that looks like. So whenever you see that on a test, a constructivism or a construct, it's an intangible, something I can't really touch. So I have to really make sure that it is measurable. So when it comes to construct validity in research, I know that either the test measures what it's supposed to do, it converges, or it doesn't. That's simple. That is construct validity, and constructs are things that I can't touch. That, of course, doesn't have a lot to do with this question. I just want to use that to help you understand. So my 4 answers: sampling only students enrolled in colleges that have not raised tuition, lowering at tuition for 1 semester and raising it the next semester, focusing on the difference in attitudes between the students who have experienced tuition increase and students who do not, and D, showing that the results apply to college students from other universities. Remember, I'm measuring external validity. So many of you can answer the question just right now, and if you can, that's fine. I always suggest, though, you go through the process. Even if you know the answer, go through the process. For those of you that are struggling, we're going to talk about how we answer a question, and especially if it's a content that we don't know, and how we use study questions and how we use test questions as a study tool. Okay? Oh my gosh, Dr. Pam, it's a research question. I'm crying already. I promise you, the research questions are going to be the easiest. They really are. They're the only time we ever tell you to memorize. Okay, so let's keep going into this question. So first of all, let's start off with simple things. Validity versus reliability. What's the most important? Absolutely, validity. Does it do what it says it's going to do? Is it valid? Okay, we've got a definition, of course. Oops, sorry. Validity is to the extent in which the instruments that are used in the experiment measure exactly what they say they're going to measure. Valid. So we talk about assessment tools, right? So, but as tools in general need to be valid. The gauge in my car, right? The gas gauge that tells me whether or not I have gas, or my speedometer that tells me how fast I'm going. Those are still tools that we use. They better be valid, right? When I get in my car and my car says it's full, that instrument better be right. Right? If I take a pregnancy test and it says I'm not pregnant, I'm going to trust that instrument to be right. That is validity. Does it do what it says it's going to do? Of course, reliability is, does it do it over and over and over again? I'll remind you that things can be reliable, but not be valid. So for test world, validity is the most important thing. So does it do what it says it's going to do? So then there's a difference between internal and external validity. Right. Okay, Dr. Pam. Now I'm like really freaking out. I'm crying over here. No, you're not. You're staying with me. You're staying with me. Most of you had a teacher at the graduate level that did not speak our language. They didn't speak social science. They didn't speak words that we speak. They spoke a different language. Every profession has their own technical terms, right? That's why we use big terms like countertransference, egosyntonic, egodystonic. We purposely try to weed out people that don't belong in our profession. So the same thing when you had a research professor that probably came from a different department, because we don't have enough people in the social science area that will really investigate and work in research. Internal validity is the inside of the research or the inside of the test. It measures how well the study is conducted, its structure, and how accurately its results reflect the studied group. Internal is the inside of the research. Does the instrument work? Does it measure what it's supposed to measure? There are lots of threats to internal and external validity, and I'll get into those in another video. But internal validity is when I do the research that I get all the right stuff to make this valid. Funny, on a test, especially a standardized test like the NCE, the social work exams, the drug and alcohol exams, what we know is the more the more valid is internally, the more it's normed to the general population. So that means if you're not a member of the white majority men that many of the tests are written for, it's harder for you. And I don't think anyone has ever pretended these tests are not biased. I think that bias in any of these fields of psychology and research is something very, very new. We're talking about it now, but we still take tests that are normed for the majority of society. So internal validity is, does this research measure what it says it's supposed to measure? Now, external validity is when I take this test and I actually give it to other people. So for example, when I say it's a reading test on the social work exams, on the NCE exams, it measures what it's supposed to measure. Many of you have taken the test before and you opened it up and you're like, oh my gosh, I didn't study this. I didn't know this. I can tell you that it's valid. Internally, it's valid. Your KSAs, your knowledge, skills, or ability, as long as you went to an accredited school, the school taught you the things that are supposed to be on this test. So it is internally valid. It's also externally valid. That means I can take this test and no matter where you go, you'll get the same results. So outside is external. So if you take the test in Pennsylvania or New York or South Carolina, it doesn't matter. It's externally valid as well. So can I give the same test, the same research to other people, especially in the real world? A good example of research that's important of external validity is, let's say that I'm working with small children and I am looking about how small children play with other children. And what I may have done is done my research in a lab where I've got this fake playground and I put in fake people, and I've found out that children play well with children at the same age. That's what I found. Now, I'm going to take this same piece of research and then put them on a regular playground where I'm not controlling the subjects. That's external validity. That means that this same research worked outside of just my internal validity. Okay? So internal, external validity. No more tears, no more tears. We got this. I will tell you that the most important thing when it comes to research and assessment is to memorize. Dr. Pam says, don't memorize anything. You have to apply everything. But math is taught through memorization. 3 times 3 is 9, whether you learned it when you were, 27 years ago or 57 years ago or 20,000 years from now. Math will always be the same. Math is the universal language. 3 times 3 is the same number no matter what country you live in. So memorize the terms. When it comes to our theorists, when it comes to our code of ethics, we have to learn them. When it comes to stats and research, memorize. So again, internal validity, that's the inside of the research or the inside of the test. My conclusions are warranted. It controls extraneous variables. What does that mean? Usually when I explain this, you have to be old enough to remember. I talk about the fly way back in, I'm pretty sure it's in the 70s. Jeff Goldblum was trying to recreate himself. He was trying to clone himself in another pod. So the movie starts and there's a fly buzzing in the room, and you see Jeff Goldblum and he's sitting here and he's doing his work, and the fly's in the room. So he goes to the computer and then he goes over to the other pod, and the fly is already in the pod. So his DNA mixes with the fly's DNA and he becomes the fly. So if you haven't seen the movie, go Google it. It's an old movie, and it was way before we had any kind of what we do now when it comes to cloning people. But anyway, in internal validity, he should have been able to control for the fly. It wouldn't have been such a good movie if he had not. But so it controls anything that may get in the way. It eliminates alternative explanations because we did it in a research lab. I can't blame it on anything else. And it focuses on accuracy and strong research methods. I did it inside a lab. It's a very controlled experimental place. Now, external validity means that I can take this same research and put it someplace else. My findings can be generalized. I know that if it worked in this group, it'll work in this group. The outcomes apply to practical situations. The results can be applied to the world at large, everybody, and the results can be translated into different methods. So internal, again, is the inside of the study, the inside of the research, and the external is taking it someplace else. Just memorize the terms. Another example of external validity, or what it may look like, okay? So then I've got my sample population, okay? So if I can take my sample population and know that it works, then I can take it back to the major population and know that it works. Interesting fact, when it comes to research, we only look at between 2 and 3% of the population. Very, very small percent of the population. And then we externalize it and we say that it works for everybody. It is not until recently that we've really looked at, does it work with a minority population? Does it work as well with an Asian population? And by the way, that's a test question that many times our Asian population metabolism is different, and it doesn't metabolize medicines the same way. Okay, so, but external validity is, I tried Tylenol, right? These people came out with Tylenol and we decided it would work on headaches and all these things. We got this very small sample population. We did a true experiment. Remember, we put people in a control group who got nothing. We put people in an experimental group who got the drug. The people in the control group may have just gotten a placebo or sometimes a nocebo. And then the other people got the experiment. Totally randomized. Right? A true experiment is randomized. We don't know who's getting what. We also know that it's double blind. Double blind belongs to strategic family therapy. Double blind belongs to research. That means that neither the researcher nor the people knew who was getting the real drug or not. So that's what it looks like when we do internal validity and we're trying to find out if this drug works. We do a lot with cancer trials, people who are at their end and they've tried other medicines and nothing's working. So many times they're willing to participate in research with a cancer drug. Okay. So again, so my external validity starts off with my little group and then takes it out to the big group. We're still not breaking out, right? We're not breaking out. No, we're good. We're hanging in there. I need some sweat maybe, but we got this. And remember, you're watching this video over and over and over again. So my words are in your head. When you see this question on the test, you're going to go, oh, Dr. Pam said. So we're back to my question. How would a study aimed at examining college students' attitudes toward tuition increase? Oh, wow, I'll try it again. How would a study, my study is aimed at examining college students' attitudes towards tuition increases. And I'm seeing if it demonstrates external validity. We're always going to rule out two. Now, on my CPC and some of my CPCE and some of my social work exams, you're down to 3 questions. So if you can only rule out one, it's really okay. But we always want to make sure that we can rule out. Okay. So I'm going to remind you again, it is a reading test. Stay in the question. There are hints and clues all over. I promise you, they're giving you hints and clues. Some of the other mentors, people say just pick a C or pick a B. That's not true. You have a master's degree. You have enough context clues to figure it out. Okay. We're only going to do that if we really don't have any idea of when it comes down to guessing. So I know that I'm looking at external validity. I know what that means, right? External validity means this research I did at this one college, now will it work at the same college? That's what it's asking me. So A, sample only students enrolled in colleges that have not raised tuition. That won't really help, will it? Because I'm trying to make it external. I'm trying to make this for everybody. Lower tuition for one semester and raise it the next. That would be great, especially if you did it right after my child graduated. That'd be amazing. Yes, we got one more semester in undergrad. And if you could lower that tuition MTSU just right now, it'd be great. But that doesn't really answer my question. C, focus on the difference in attitudes between students who've experienced tuition increases and students who have not. I like that one. And D, showing that the results apply to college students from other universities. Now, C and D at least both talk about other colleges, external validity. So I got rid of A and B, and now I'm down to C and D. Okay. My answer is D. If I demonstrate that the results of the students apply to students from other universities, the researchers are ensuring that their findings are not limited to that specific university. I'm going to go back to the question to make sure that we got there. So I said I was between C and D. Okay, let's go back to the question. The study is aimed at examining college students' attitudes towards increasing, how I'm measuring attitudes when their tuition increased. And again, I said I was on C and D. C says focus on the difference in attitudes between the students who have not experienced tuition increases. So I can't compare apples and oranges, can I? The goal is if I did this attitude at this school, will I get the same answer at another school? That is external validity. Okay. So really not that hard, guys. I promise you, internal, external validity. Internal is the inside of the research. The external is the outside. Can I use it other places? Let me give you some reasons why the others are not correct. A, sample only students enrolled in colleges that have not raised tuition. Well, that wouldn't work, right? Because they haven't raised the tuition. I want to read this to you. Limit the sample to students from colleges without tuition increases would fail to capture diverse perspectives and would decrease external validity since it includes an important variable. Remember the independent and dependent variables, right? In this one, what I'm measuring is tuition increased. That's the dependent variable in this question. Okay, what is your attitude toward the tuition increase? B is not correct. Lowering tuition for one semester and raising it the next really just experiences. It doesn't measure. I can do it internally, but I can't do it externally. The approach focuses on an experimental manipulation and testing causal relationships rather than addressing the findings. By the way, causal relationships are going to be quantitative. Quantity, cause and effect is always quantity. And C is not correct because focusing on the difference in attitudes between students who have experienced tuition increase and students who have not, it may enhance internal validity, but I'm not asking people the same question. So that cannot be external validity. I hope you found that this question really just wasn't that bad. Not at all, not at all. We make research sound easy. We save it to the very end because we say you just want to memorize. And by the way, you can find us at Academic Coaching for World Changers. We've been around for quite a long time. We continue to grow. I have a staff of 13 other tutors. I'd love to see you in a group session or a live session. We truly believe that you can do this test. We can do it one more time or just one time. Stop wasting your money. Stop wasting your time. There are people out there that really just need you. Thank you most of all for choosing to be a world changer.